data shows that the 10 microgram dose works very well at preventing symptomatic COVID-19 in children aged 5 to 11 years, with an estimated efficacy of 90.7%. This is very similar to the level of protection achieved with a 30 microgram dose in adolescents and adults. Given the current and prevailing epidemiology of COVID-19 in Canada, where incidence rates have remained highest in children aged 5 to 11 years for most of the fourth wave, today's announcements on the availability and use of the pediatric formulation provides a welcome additional prevention option.
I'd like to reflect on what this authorization means for people in Canada. Overall, this is very good news for adults and children alike. It provides another tool to protect Canadians, and to the relief of many parents, will help bring back a degree of normality to children's lives, allowing them to more safely do the things that they have missed during the last 20 months.
Pfizer's vaccine for kids between 5 and 11 has been approved by Health Canada. The regulator says the shot is 90.7% effective in preventing COVID in kids. The first shipment of the vaccine will arrive this Sunday, and a total of 2.9 million shots are expected to arrive in Canada by the end of next week.
And many parents have been waiting for this approval, and we know many parents also have some questions. Joining us tonight, Dr. Dina Kulik, a pediatrician and founder of Kid Crew, Dr. Alan Grill, the chief of family medicine at Markham Stouffville Hospital, and Samantha Yamin, who is a neuroscientist and science communicator, and Samantha, also known as Science Sam. So good evening to you all. Dr. Kulik, I'll start with you. Let's talk about the significance of this authorization in this shot for children.
It is very significant for many parents who have been waiting very patiently to ensure that they can get the vaccine just like they got it, knowing that the world has really opened up to many of us that have been vaccinated. They want the same thing for their kids, and they want to rest assured that their kids are much less likely to get COVID, and for sure, much less likely to get very sick with COVID.
Samantha, you know, you're known as a science communicator, and there's going to be a lot of questions and concerns coming from parents. And when it comes to the communication about these vaccines, and especially when it comes to the dosing schedules, we're already seeing confusion, especially when it comes to Health Canada saying that they're going to go ahead with the 3-week recommended interval, and NACI is saying they're recommending the 8-week interval. How confusing is this going to be for parents, especially given the fact that, let's just be honest, NACI didn't necessarily gain a reputation for its masterful public relations and communications throughout the pandemic?
I can maybe help clarify that now. Health Canada always makes approvals based on what exactly was done in the clinical trial. It's kind of out of their purview to make changes based on evolving evidence, and that's exactly what NACI does. And NACI actually, you know, we can say all we want about some of the communications, but they do a phenomenal job at evaluating the science. They really are our country's best experts. And so when they say they recommend it to be used with 2 doses 8 weeks apart, that's based on evidence outside of trials, but really strong evidence emerging in Canada and from other places around the world that it gives you higher vaccine effectiveness that lasts longer, and it may even further reduce the risk of myo and pericarditis. And so that's why NACI is going with that 8-week mark for 5 to 11-year-olds. And in fact, they also made that same recommendation on October 22nd for anyone now about to start their primary series who's 12 and up too.
Just furthermore on that, Samantha, wouldn't it quash some of this confusion if Health Canada and NACI work together so that they effectively communicate one message?
They do work together. I totally hear you on that, and completely agree that it makes it confusing. But I think the important thing as a regulator, Health Canada has to and can only authorize based on what the company, the manufacturer, Pfizer in this case, submitted. So they have to authorize based on what was done in the clinical trials. But that's why they have NACI to then go and say, okay, that's great, you authorized it, but here's what we think would be even better than that.
Dr. Grill, what is different about this vaccine compared to the one that adults and those who are 12 and older are currently receiving?
Right. So this dose is less. It's a third less than the Pfizer dose that adults are getting. And that dose was picked based on the clinical trial. And the idea there is to find a sweet spot between getting a good immune response that's going to protect the 5 to 11-year-olds against COVID infection, while at the same time minimizing side effects. So the idea here is that we're going to give the kids good protection. And when they did the trials, you know, as you said, 90% protection of the kids that got the vaccine versus the kids that didn't get it. We didn't see major side effects. The main ones were pain at the site. There was fatigue, headache. So we didn't even see the same sort of systemic effects like fever and feeling achy the next day in the trials with these kids. And I think the other thing that people were worried about was the myocarditis risk. And we know that myocarditis in this age group in general is less. And when we use Pfizer for people that are 18 to 24, it's about 1 in 28,000. So the idea here is that if you're going to give a lower dose to kids 5 to 11, the chances of that side effect will be even less. And we haven't seen a signal of that yet in the United States that has already been using this vaccine for a couple of weeks. So the dose is less. Hopefully, we're going to get a good immune response and less side effects.
Dr. Kulik, we just heard from Dr. Theresa Tam, and we know that throughout the fourth wave that the largest number of cases is coming from this specific demographic. We know that there's going to be difficulties for the anti-vaxxers to get on board with vaccinating their children. But what would be your message to those individuals, even those who are adults who are vaccinated but are still reluctant to put this vaccine in their children? What's the message you really want to send to those individuals?
I think it all comes down to good education, evidence-based, effective communication with families to show them that the evidence shows that it's safe, that it's effective, that there are minimal or no side effects from these vaccines. And I think a lot of families, once they see so many individuals getting it in the United States and eventually here as well, the children, and they do well, a few million people, a few million children have received it in the States, and we haven't seen large numbers of cases of myocarditis, pericarditis, or other significant side effects related to this vaccine. I think a lot of people will come on board realizing that it's not as scary as they thought. And we saw the same thing with teenagers and when it was rolled out for adults, that people came, to the other side once they realized that it was safe and effective and allowed them to live a more normal life again because of that protection.
And Dr. Kulik, you're a pediatrician. You talk to parents every single day. What's the most common question about the vaccine that you're getting right now?
I think safety is the biggest thing. A lot of parents think, well, this is a new type of vaccine. We've never used mRNA vaccines in children before. How could we know that they are safe? How can we know there's not going to be long-term side effects? And it comes down to that education piece. mRNA vaccines have been around a long time. They've been given to kids, but we do know there's safety data. And we know it's not going to change your child's DNA. The fertility myth is a big one that we're trying to squash. So it really comes down to hearing their concerns and reviewing with them the actual data, the actual evidence, not this mythical stuff that's, being passed around on social media.
Samantha, when it comes to just kind of circling back to the intervals again, we're hearing that that it offers robust efficacy over long term, but the reality is we've got the holidays just around the corner. And we've always kind of referred to this pandemic kind of as a war, and that the vaccine adds that coat of armor. Wouldn't it be a better idea, or would it be sound science to have a little bit more of that vaccine as added protection heading into this time where a lot of kids are going to be interacting with other kids and other family members over the holidays?
Yeah, it's a tricky thing. And especially when we see our neighbors in the States who will have fully vaccinated kids by holidays, it's really easy to be kind of frustrated that we won't have that here. So I totally empathize with parents who are upset about that. I think what's important, though, is NACI has to make recommendations based on what they believe scientifically to be the best. And we know from many vaccines that longer intervals, general vaccine principles are that gives a better immune response. And so I think it is their responsibility to make advice simply based on what is best. And given the state of the current wave and the assumption that people will still have to take some mitigation measures over the holidays, I think this makes sense according to them, the experts, it does make sense from an epidemiological standpoint. But it means that we will still have to be thinking in our minds about ways to reduce risk over the holidays.
And Sam, just to pick up on that and still looking at the interval doses, we're curious, who will kind of sign off on how much time there will be between the first and second dose? Is it going to come from Health Canada and then the provinces and territories decide? How does that work?
Now that NACI's made that recommendation, it's up to the provinces and territories to decide the exact logistics and the rules that they'll kind of make. So they could tweak things for specific, maybe higher risk populations. They could tweak things if a healthcare provider suggests it. We're not really sure what each province and territory will decide, but it is within their jurisdiction to fully accept NACI's recommendations or fill in some of the gaps, because NACI kind of left a blanket statement on the 8 weeks and didn't give any subpopulation type of specifics.
Dr. Grill, we're just hearing about this announcement today, and I'm just curious what doctors like yourself are preparing to do. Is there anything that's going to be different in your office when it comes to the administering of this vaccine, the education behind it? I can only imagine that the questions are only going to intensify as we get closer towards putting those jabs into children's arms.
Yeah, for sure. I mean, I work in York Region, and there's been good primary care representation on various committees to decide and figure out how we're going to roll this out as soon as the announcement was made. And we're all very excited that the announcement was made today, including the physicians in my office who have young kids. They've been chomping at the bit, waiting for the announcement. So I think what's going to happen is there's going to be clinics that are located at schools. And the reason why is because kids are more comfortable in those environments. They're going to be run after school because a lot of parents want to be there with 5 to 11-year-olds when they get the vaccine. They're also going to be open on weekends in case you have working parents that can't make it after school. You're going to have pharmacies offering the vaccine. You're going to have family physicians and nurse practitioners offering it in their office. And my hospital at Markham Stouffville is also scaling up its mass vaccination clinic, and we're going to have clinics on weekends as well. The other thing that's really important is we're making time to sit down with parents and answer questions. So any parent, even if they're a bit hesitant at first, as long as they're open to the conversations, we know that it's just a matter of time for them to get the right information, be comfortable, get all those questions asked. Some parents are raring to go on day one, and other ones need a little bit more time. So we have that opportunity in our offices to answer those questions. We even have opportunities in the clinics to answer questions for the kids and the parents. So you set up an environment where there's a little bit more patience. And most of the time, in my experience, even with adults, as long as you have that sort of two-way conversation, we leverage the relationships we have with our patients. Most people are very happy to get the information, and they're pretty much on board in terms of getting the vaccine. And I have no doubt that with a little bit of time, whoever is still sort of contemplating this will likely speak to their friends and be very willing to immunize their kids because they know that the benefits far outweigh any risks of associated with getting COVID.
Dr. Dina Kulik, Dr. Alan Grill, and Samantha Yamin joining us live this evening. Very important conversation for our viewers, so we certainly appreciate your time. Thank you.